Come in. I'm Dr. Lorri Lankewicz. I am the owner of Balance for Wellness Physical Therapy and Integrative Health Center. And we have 2 locations at the moment. I'll talk a little bit more about our vision later. But we really exist to bring integration into our healthcare system. It is one thing right now that I think that the hospitals wanted to do probably at the initiation of creating hospitals, but it seems that that has gone by the wayside. Now, that doesn't mean that hospitals aren't necessarily, because they definitely are. So as we go through the talk, we're going to talk about some different points, different things that are going on in healthcare right now, ways that we think we can make it a little better. So at any time, if you have a question, if it's not a great time, I'll just ask you to hold, but at the end we can take a few questions as well. So the talk is why integrative medicine and why now? And we're definitely going into that. But before we do that, I want to give a little history about Balance for Wellness. So back in the year 2000 is when I actually created Balance for Wellness. At that time, it was Physical Therapy and Wellness Center. And my vision was to provide physical therapy, but also to find other practitioners who weren't physical therapists to come and join us and to help us look at health in a holistic way. You know, and this integration has gone through many terms over the last 20 or so years, probably 30 years. Alternative medicine back in the 80s and 90s, to complementary medicine, probably 90s into the 2000s, and now integrative medicine. So the story is actually kind of neat because I've been a physical therapist now for over 20 years. And my early career, my background is athletic training, sports medicine. That's my bachelor's degree. My master's degree is as a physical therapist, and my doctorate degree is a physical therapist. When I came out of school with my master's degree, I was an orthopedic PT. We were based in sports, but we would treat everyone, and I lived in Ohio at the time. We were definitely, somebody's injured, we're looking at that injury, post-surgery, we're going to move that shoulder, we're going to make it better, we're going to make that knee better, that back. But we really weren't, the companies I was working for were bigger hospital systems. We were not doing integrative medicine. And so I stayed involved in PT from 94 until 99 in the Ohio area, and then I came back to Pennsylvania. And in that time, just prior, I was managing a very large home care, and I was also helping out with the outpatient clinics. And I just found that there was something that wasn't right in me. I thought there was a bigger picture, and I couldn't figure out at that moment what it was. But I knew that there was something that I was supposed to do. And even after the poking and prodding of that healthcare system to ask me to stay and we'll pay you this money and so on, I knew that it wasn't about the money. And I needed to come back home to Pennsylvania, do some healing of my own, and then follow on some road which I didn't even know what the road was. So I came back, and I actually was providing home care services around this area. And then I got to the point where I just, almost bottomed out. I wasn't sure if I wanted to be a PT. All my life had been a caregiver. And I thought, I'm burning out of caregiving, and I don't know what to do about it. And so I backed out, and I was providing massage therapy and kind of playing in my own little game. I had people asking me and telling me that I should open my own business. And I kept telling them, I'm a physical therapist, I'm not a business person, but things kept leading me in that direction. And so one day I had a conversation with God, and I had a hand drum, and I was banging on that drum, and I was praying, and I was yelling, and I basically said, I need you to show me why I'm here or get me out. It was definitely not a suicide mission, but it definitely was I need a road because I don't know what to do anymore, and I don't feel happy. And I want to feel happy, and I want to help other people, but how do I do it? And so I started sending out resumes, and I was in Pittsburgh at the time, and everything was bringing me north on Route 8, up Route 8. And I kept saying, I'm not moving to Butler. And the voice kept saying, you're moving to Butler. And I kept saying, I'm not moving to Butler, you're moving to Butler. I moved to Butler, actually in 2002, and it has been such an amazing ride since. So we opened the first center actually in an athletic club in Butler, a very small space. At the time, I was providing PT services. I was teaching yoga, weight loss, coaching. And we grew out of that space physically and energetically very quickly. Opened another space up in Butler, stayed there for 3 years. And presently in Butler, we have a space we've been in for 8 years. It's an old bank and very well known. We have some great roots there. And then just about 3 years ago, I started looking. And my goal when we moved into the final building up there that we house now was to stay there for 5 years and then determine if we would expand in Butler or open a second clinic. And so as the universe has done for me and God has led me, things happened and it led me to here. And so we have a smaller space in Butler, and when I opened this, obviously a very large space, I just decided to go for it. And all the things, all the practitioners, all of the services, everything that we had provided, my goal was to bring into here. And I will say that just over the last couple months, we've really added some practitioners, so we're literally providing integrative medicine at this time. And it's amazing, you plant the seeds and you go through mud, you crawl and you walk and you yell, and because you wonder if you're going to make it physically, mentally, emotionally, spiritually, and then all of a sudden something happens and the flow comes in. And I truly believe Balance for Wellness Integrative Health Center is in that place right now. So presently we're having conversations with medical docs, people that are not happy in their establishments, most of them in very large healthcare systems, and some of them even that are in private practices and are happy, but they're not integrating. And so they're calling us and saying, we've heard about your vision, we want to be a part of it, which is like unbelievably glorifying, to get to that point. Because of all the integration we've done to date, we have not had a medical doc of any kind that has come in to say, I want to join. I may have put out some little sprinkles to them, but now it's happening. And so we're actually, we have a psychiatrist and a few physical medicine rehab docs, a popular doctor in Pittsburgh who has his own business we'll be talking to on Tuesday. And so our goal now, this is a beautiful space, however, our goal is to get into one space. And so we are in the process of settling on a new space, actually on Route 8 in Penn Township, which is directly in between our two centers. It's also a building that, not surprisingly, I looked at through the windows about 7 years ago and thought, wow, this would be a really cool space. And then about 3 years ago, the guy that owns the building showed up in my life. And so now we are in the process of moving there. And so with being in that integrative center, as I've said already, we are looking at physical therapy. We're looking at medical physicians. We're looking at psychotherapy, hypnosis, chiropractic, massage, Reiki. Everyone that you see involved in our center right now will move into that center as well. And it'd be my guess that not too far in the future we'll have a larger center because we're already not sure if we have enough space there. So that's kind of a fun thing. So that's kind of the history of Balance for Wellness and what has brought us here to today. Other parts of Balance for Wellness and a sister company that will be showing up here very soon, Inspired Wellness Institute, has also been a dream of mine that I incorporated multiple years ago. And that company will literally be an educational, coaching, public speaking company. So through that, we'll obviously be coaching and speaking and teaching people about integrative health, medicine, all of these different things. But we'll also be doing leadership training and personal coaching for young children, adults. Very, very needed. I'm in the process now of going through a certification to actually go into businesses and help them with leadership, emerging leaders. And the reality is, as we talk to companies, people don't listen to each other. The top people aren't talking to I'm using this semantically, if you will, but top and bottom people, the higher ups and the lowers. What we really need to do is integrate that. So integration really has a very broad spectrum, if you will. It's not just about healthcare. It's about all of us learning to start to listen more and to give more, but to do it in a way that we all feel like we are being cared for. So we're very, very excited about that. So why integrative medicine and why now? Obviously, there's some big changes going on in healthcare, right? Lots of changes going on in healthcare. And those changes are occurring because they're needed. We still don't know about the Affordable Care Act. We don't know if it's going to be the best thing since sliced bread or the worst thing, like burnt toast. We just don't know. People are signing up and getting health care for the first time maybe in their lives. Other people are saying it's too expensive. And so we just don't have all of the information yet. With that, though, what's happening is everybody's looking at health care, right? I had a friend once that made a statement, which I thought was interesting. She talked about cockroaches that hide in the dark, and until you shine a light on them and they scatter. And so what we're seeing all over the place right now, in the newspapers, on the news, everything else, are some scattering of cockroaches. You know, who's charging too much money for health care? What are they doing? How are they undermining the client? How is all that working? And obviously we're getting a lot of very negative feedback. So one thing about integrative health, why now, besides the global picture, which I'll get into in a minute, is right here in southwestern Pennsylvania, we're obviously not enjoying the big fight that's going on between the large systems. And that it's very sad. It's very disheartening to turn on your television and see and hear these ads, to see billboards, for it to be in the paper, for very large places that are making a lot of money to really be messing around with our lives. And so there are a lot of very disgruntled employees within those systems. And that is, you know, the people that are in maintenance and repair, to the physicians, to the dietary, it doesn't matter. They're all involved in systems that aren't really giving back to them in a positive way, and we keep hearing that more and more. The issue with that then is, you know, over the last couple years when all this started, what we started hearing as private practitioners was, you won't be able to stay in business. The Affordable Care Act is going to hurt you. The big conglomerates are going to take over. They're just going to come in and hire all these practitioners, and you won't be able to stay. And so, as I do, I had my moments of, oh my gosh, like, are we going to make it? And I'm scared, and what do I do? We don't have enough money to battle this. And then over time, and a lot of prayer and a lot of guidance, it was, I don't have to listen to that. I don't have to choose the fear. And we have this integrative model. How do we make it so that it is complete enough that people will choose to come to us because they want the holistic model, that their insurance will pay for it, but people will also say, I'm also willing to pay for part of this, which we should be doing anyway, and make it so that even those big insurers start to say, wow, what are they doing? And so we need to, as a conglomerate group of integrative practitioners, provide that service, and then actually just do research and show that we are effectively changing people's lives. We're reducing symptoms. People are just able to get up and walk and live and feel better, but also that we can reduce costs. And that is the biggie. And so when we look at, again, there's home models, the medical model that Highmark is building over in Wexford. It's a wonderful model. Their model is what we're already doing. They're just doing it in a larger scale. So when they open, whenever they are in their 100 and some thousand square foot facility, there'll be MDs and PTs and OTs and audiologists and medical spa and, you know, whatever else they can fit in that building. And that's wonderful. I love that concept. The thing is, we can also do it on a private scale. And we're doing that. Because what we want to do is to be able to do that really with maybe not as many politics saying, well, yeah, we want to go in that direction, but I'm not sure if we can actually talk about nutritional supplements. Whereas we know that we have multiple articles and there's multiple research going on showing that we can effectively help change physiology using nutritional supplements. Does that mean we don't need medications? Absolutely not. And the thing with integration with me is, I'm talking Eastern and Western. It's supposed to work together. We're not supposed to just be doing this or just be doing that. And Balance for Wellness has been that bridge for multiple years. And we're just actually expanding the width of that bridge and the length of that bridge because, hey, you know, if something happens to you, if there's a catastrophic incident, if you're in a major trauma, we want you to go to Mercy. You know, that they do incredible work when it comes to traumas. Or even, you know, if you have cancer or there's something else going on, that there may be an initiation of a medication or some type of procedure that you need to save your life. We need that. Now, when we're talking more about some of these chronic issues, thyroidism, chronic fatigue, fibromyalgia, just weight issues, diabetes, type 1, type 2, all these different things, what are we missing in the medical world, in the Western medical world, that we're just saying, okay, you're going to take 19 medications and they're all going to interact and they're probably not going to interact well and we're not sure that you're really going to get better, but we'll keep you alive for a while. we need to be able to look at the depth of that. And so I want you to imagine a place where there are medical docs who are willing to say, we're going to do blood work, we're going to do whatever tests we need, and then we're actually going to utilize that information. We're going to dig into the information to see what vitamin deficiencies you have, what's going on with the thyroid, what's going on with your pituitary gland. These are all not in sync. So with that, what kind of medications can we do? But wait, what kind of supplements can we do? And hold on, what are you eating? Everybody wants a quick fix, but what are we putting in our mouths? One of my favorite sayings for years, and you can ask multiple people, I say to people, we want to drive our cars in, our bodies, and add diesel fuel when we need unleaded gasoline, right? We stop at all these places, we don't eat correctly, even if we're eating out of home, because a lot of it is about our lifestyles. We're very quick, we want everything done right now, we want the medications right now, and so what's quick and convenient and easy, okay? And I get that, I've been there myself. However, even at home, when we think we're trying to do something good, we don't know how to read a food label. We pick something up because it says it's fat-free, dairy-free, sugar-free, but there's a whole big paragraph underneath that is saying words you can't even spell or even speak. And so, should that really be in our food? And there's such a large push right now for organics, but what's really organic? What's good for our bodies? Dr. Oz says this, so everybody runs for it, but what if that's not what you need? And so there are many ways to test that, but this is really about grassroots. Truly, it's about digging in and us educating people to the extent that people are ready, willing, and able in every regards to start to pull up the dirt and say, what is it that I need to do along with you as my healthcare practitioner in order to change my life and change my health. And what we haven't done for the last 50, 100 years, probably 50 plus, when medical insurance came into being, is we shifted all that. We took it off of ourselves. Now we have insurance. Someone else is paying for our insurance. So I'm going to use that insurance, excuse me, and I'm going to go to Dr. Lorri or Dr. Melissa or Dr. Chaudhry, whoever it might be, and say, here's my insurance. They're going to pay you. You fix me. And I want this done tomorrow. And that's what we've done, and we believe that. We have believed that as medical practitioners, that that's our charge. We feel like if you come to us, that we should somehow, some way be able to fix you. And there's a lot of ego that gets involved with that in the healthcare world too. If I can fix you, look what I've done. But the reality is that's not what it's supposed to be. This is a partnership. Again, we're talking integration. It's integration between your healthcare practitioner and yourself. What changes can you make? And what I'm going to start asking people, and we already do, but I'm going to put a little bit more emphasis on this now. What are your goals? And what are you willing to do to get there? And then I will give you a roadmap, but as long as you got to stay on that road with me, because if you don't, then I truly cannot help you. Okay, so it's a different way, but that's the biggie that's going to come out of this Affordable Health Act. Whether it stays or not, I don't know. But what's happening is, and for businesses to start pulling out and saying, we're not going to provide health care anymore, you go find your own health care, that's going to educate people. How much does this stuff cost? If I pay for this, how much do I have to put into it? It's going to change because people are going to start looking at this just from a different perspective. They really are, because really your health care is up to you. But we are here. We want to be here to help you along that journey. Just want to check on our time. So physical therapy, where do we belong in this? For multiple years now, up until 2003, when direct access came, and I'll help you understand what that is. Multiple years before that, we could only evaluate and treat someone if a physician handed any one of you a prescription and said, okay, here's your script, this is the diagnosis, this is what I want them to do, these are the modalities that they use, you're going to go this many times and that's it, and you come back to me and we'll decide if you're better or not. And so that's what we did. In every one of our systems, we could not treat unless that script came. Well, prior to 2003, many other states had something called direct access. And in 2003, Pennsylvania, we were awarded direct access. And what that means is that you can come directly to your physical therapist without a prescription. We can evaluate you, and we can treat you, and we devise your plan of care, and we help you along your way. Why is that so positive? Because we evaluate you, we treat you, we're about function. We're able to look at the system, the muscles, the nerves, the joints, and we're able to tell you what's going on functionally, and we start treating right away, and so we can effectively start to change your physiology very quickly. And we do that by what we do with our hands. We do that by modalities that we use, but you're also part of that because you're going to exercise, you're going to stretch, and you're going to work on this with us and do some home exercise programs. Let me, just a show of hands, who knew that we had direct access? Who knew you could come directly to us? Excuse me. So about half the room.
You mentioned last year.
Right. So,
How many people knew we had direct access?
did you know you could come directly to us?
No, I didn't.
Okay. So about half the room, and probably the half, most of the half that know me and have been here. So. Most people don't, and still don't. 2003, this is 11 years later. I can't count the amount of articles in newspapers, the amount of radio shows, the amount of people that have come in and out of our offices, and people still don't know that they can come directly to us. It's a different paradigm. It takes a long time to have a paradigm shift, but it's a very positive paradigm shift. Now, in that, as we evaluate you, we're looking at, again, the nerves, the muscles, the joints. But if you say to me, you know, I'm having burning on urination, my back hurts, I'm not sure what's going on, I'm looking at neuromuscular skeletal, but I'm also saying, wait a minute, you might have a kidney issue, let's get you over to your doc. Or if we take it to the arm, the rotator cuff, I'm doing tests. I think you have a rotator cuff tear. Can we treat that and move forward, or do we need an MRI to tell us if it's going to be effective or not? What that does, if you can think about costs, and how we can reduce them. Even if I say to you, I believe, I'm diagnosing that you have a rotator cuff tear, but it's mild, and we can rehab that, and you'll get full motion and strength. That means no x-ray, no MRI, no medications, thousands, 5,000 easy, depending on which hospital you go to. It could be 2,000 to 10,000. So right away, we'll just say an average of $5,000 gone, okay? Because the other thing is, yes, you have inflammation there, but do we need you to be on a Celebrex or naproxen or something like that? No. What if we have an alternative use that we can use, an alternative medicine, if you will, and that could be Boswellia. It's a natural anti-inflammatory. Bromelain, it's a natural anti-inflammatory, and the list goes on and on. What if you have so much pain in that you're not sure and we're taking you through it, but you think maybe with a little help we can reduce that pain? Oh, we happen to have a clinical hypnotherapist who's in the room that can help you to calm down and hypnotize you, and maybe even have a dental procedure without the use of Novocaine, which she does to herself. So that's what we're talking about. You know, pain clinics have jumped up everywhere. We work very closely with a local pain doc. We love her work. When you need it, you're going there. If we can somehow reduce that pain before you need that injection, we are definitely going to try that with you. But it's about you. Are you willing to change your diet? Are you willing to buy a nutritional supplement that's going to work? So physical therapy in itself has always been a practice that is about restoring function, getting people up and going again. You might have a surgery, an accident, whatever it is. We look at you and we say, okay, your strength is not where it needs to be, your joint isn't moving correctly, you have muscle spasm and pain, let's get you back on your feet again. Okay, again, if you come directly to us and we start treating versus going to the PCP who says, well, let's put you on this medication, go home, sit on the couch, use some heat, maybe try these stretches, come back and see me in 2 weeks. If it's not better, well then we'll look at some other diagnostic tests. So it could be 2, 3, 4 weeks before you see a physical therapist. The other part of that is our training is so diverse. At this point, doctors of physical therapy are in school either 7 or 8 years. When I went to school, we didn't have doctors of PT. Actually, when I had my bachelor's degree, we didn't even have masters of PT. So I finished my bachelor in 1990. I went back in 94 for my master's. went back 10 years later for my doctorate degree. Now every PT that goes into school is coming out with a doctoral degree, just like a medical doc. All right, so we're trying to be on that same playing field, and I say trying because Medicare still limits us a little bit on what we can do. In the future, that will change, and we're working on that diligently. However, PTs at the forefront of this, again, are looking at function. How do we reduce costs again? How many people are ending up in nursing homes or other places, people caring for them 24/7? I'm not saying that we will stop that forever. I would never say that. But what if we could keep people moving for a longer period of time? Will that help to reduce costs in our medical world? There's so many possibilities. So PT, I mean, obviously I'm a physical therapist, so I get really excited about it. However, I've seen other PTs, and I've seen other practitioners in different ways, and we listen to our clients day in and day out who say, my physician didn't listen to me. They told me to take these meds. My mother, as a matter of fact, and she's very much a part of this, and hopefully she's okay if she ever sees this, but we've talked about some issues that she has had. And so she went to the physician, and he said, it's this, so take something for your stomach, and come back and see me in a month. And I said, Mom, we can change that. We can change your physiology. We can help you change the way you're eating. You can take some supplements. And her response back to me was, Lorri, I know you can tell me this. I just don't know if I can follow it. She was honest. Right then and there, I get it. You know, she'll ask me for help when she needs it. However, just in that situation, this was medical doc, let me reduce your symptoms. This was Dr. PT with a nutritional background, coaching background, let me help to change your physiology. And so you now have the choice. My mom was honest and said, I love you, honey, and I know you're right. I just don't know if I can follow it. Okay? So again, we're talking about integration between client and healthcare practitioner. So many possibilities in this world, and we're so excited to be on the forefront of this. I truly believe, from what I told you from back, when I started this in 2000 and where we are today, and that driving up and down that Route 8 saying, I'm not moving to Butler, yes you are. I truly believe that was a movement that was so far beyond my reach. I had no clue, first of all, that I would be opening one clinic, even though other people thought that I should, to now have two, and then to be combining, and maybe we'll combine, and then we'll start putting these integrative health centers around Pittsburgh. Very possible. I think that's very, very possible with the medical practitioners that want to be involved. I had no clue. I say this with love in my heart. I'm a little girl from a row house. That's where my roots are. I grew up in Pittsburgh. We were not wealthy people financially, but I've always had dreams. And I've always believed that if I had that dream and I had the spiritual background and the spiritual push, that we can make it happen. In a training that I'm going through for leadership, my friend Sam, who's out there right now, talked about a visionary and what a visionary is. And the visionary obviously brings something to the forefront, and they become a leader because they can actually stay with it until the vision comes true. And so I have been blessed in this life to be a visionary, and I've also been blessed to have the background, the education. My mother calls me a terminal forever student, which is fine, to actually make this happen, to have the leadership skills to say, come and join this because we can change people's lives. And so, stay with us because there is so much more to come. Over the next 5 years, Balance for Wellness is going to be a name all over Pittsburgh, and I'm sure beyond, where people are saying, what are they doing? How are they doing this? Because people are going to get better from the depth, from the root of the illness, not just we're squelching the cause or the symptoms. We want to get to the cause. We want to get to that root, not just squelching the symptoms. And so I appreciate you all being here. The fact that people are coming through here today, it's a gorgeous day, and people want what's going on here. And they're finding us really tucked away in a little plaza, that you're all part of that. I am truly, truly grateful that you're here. And I truly appreciate that. We have a few more minutes. Any questions for me? Thoughts? Yes?
You don't have a acupuncture.
We don't, and I'm glad you said that. And I'm going to put this out there because we're filming this. We're getting this out to the world. We want an acupuncturist to join us. We absolutely do. I've talked with a couple people. They're just not in the position, but I guarantee you the fact that you just said that, that acupuncturist is going to show up very soon because we are.
I had it once, and it was wonderful.
Yeah.
I mean, it took care of the problem
Yes.
when nothing else did.
Absolutely. And acupuncture opens the meridians. It opens the flow in our systems. And so these little needles on the right places, obviously the people are very specialized in this, but they can open flow. And we're shutting down flow. Breathing. We don't know how to breathe. You know, all day long, we're either at our computers or we're stressed or we keep going like this. And what we want to do is be like this. And wait a minute, do we actually feel good enough about ourselves? Do we have enough self-esteem to stand up, to put on a red suit and say, here we are, to go out on Route 8 in a glass building, because we have glass everywhere, to say, here we are. And I'll take you back to 2002 when I opened in Butler, and I was teaching yoga and we were talking supplements. I was the voodoo lady. Who is the voodoo chick that moved into town? No one knew me. No one knew me. I'll tell you now, and I say this humbly, you go into Butler and say, Dr. Lorri, they're going to say, oh, Balance for Wellness, they're great. So it's big, big shift, you know, but this is it. This is the other part of it. This is the coaching part, the teaching part, because part of health, we're talking mind, body, spirit, right? So, I mean, our body, we can feed it with wonderful things, but if we're not in a good place in the mind, if we're not in a good place spiritually, if we can't reduce our stress, we're not going to be healthy. Stress kills us. It's a catabolic mechanism on our systems. So we need to make that shift. Any more comments or questions? Yes?
When did you add orthobiology?
Orthobiotomy probably 2 or 3 months ago.
So how do you feel about your opinion on active release technique as a good standard for ligaments, tendons as we age?
Yeah, I love it.
Wear and tear.
Yeah, we use active release every day in our clinics.
But don't you have to be a physical therapist to use it, or a chiropractor, I thought?
I'm not sure about
I
that.
think that's what you have.
To be honest, I would say you have to be trained. Massage therapists may be trained in ART.
I never could find anyone that I thought, I looked it up, they said you had to be a PT or
Okay.
I was just curious.
Yeah, active release technique is basically looking at a muscle, and the muscle can be shortened. There can be muscle spasms. And so basically we're applying pressure to the trigger point, and then we're moving back and forth however that muscle moves. Okay, so say it's on a hamstring, we would actually press on that and actually bend and flex the knee, which would lengthen and shorten the hamstring. It's a great technique. It goes along with contract, relax. We use that a lot as well. And it's not, it can be tender and painful for sure, but it helps to really break that. Yes, yeah. Yes, but differently, because you're not looking at a contractile tissue. What I will say also in that, if you find a really good massage therapist, Morgan Pittman, who has joined us as well. Morgan is, I'm with Morgan weekly now, and she is using her hands, her elbows, her forearms to really I'm a very busy person. I use my body a lot, so I have trigger points, and she will do lots of different techniques to help to increase blood flow. That's what we're looking for, reduce spasm. Okay? Yes?
Where in Penn Township are you?
We will be, it's the old car dealership, which is about catty corner from Hardwood Cafe. So north of Dinner Bell Road, maybe, I don't know, 2-3 of a mile on the right.
Okay.
Yeah. The cranes are in the back, we'll be in the front of that building.
Amen, sister.
Esme,
That is wonderful.
I used to pass you every day.
we're not there yet.
Oh,
That's where we're heading.
Okay, well, there was a place.
There's still a place there.
A place called something or other.
Yeah, I don't remember the name of it, honestly. It's one of the old brown log buildings. There is a wellness and massage place right there. We'll be just 2 parking lots north of that.
How far is that from here
10 minutes
to the new location?
to the new location. Yeah, it's like 10 to 11 from here and 8 to 9 from our Butler.
When do you expect to be there?
Fall. We'll be there in the fall.
So we can call the place at the Balance for Wellness for
Yep.
appointments.
Correct?
And still go there at this moment?
Yes, both of our locations, this and the one on Hanson Avenue, are still open.
Well, I know how much you've helped me through the years. At 84, I'm still here, praise the Lord too. And the point is, I have a young granddaughter, and I'm going to bring her to you because I can't fix her. You can.
Amen. I'm sure you've tried with love. Now you just need
That's right.
the medical side. So, and I appreciate you being here, honey. She's been with us for multiple years, which truly is a testament to us. We have multiple family members that starts, and before we know it, we're treating, grandmas to grandchildren and everybody in between. And I will end this with, we're dedicated. I think you can see that in me. I think you can feel that from me. This is my life mission. I'm on cloud 9 right now with my feet firmly rooted in the ground because we truly, truly want to help people be whole and healthy and feel like there's a reason to be on this earth. Like I said multiple years ago, banging, show me or get me out. Yes, David?
No, go ahead, I'm sorry.
No, I'm done. That's fine.
I just wanted to kind of back up a little bit.
Yeah.
And when you were talking about MDs versus physical therapy, and I just want to stress the importance, of me being a PT patient for a number of years, ex-athlete, always, something hurt, I always went to the doctor. In today's healthcare world, if you will, as far as payers go,
Yes.
health insurance companies, they're more on the end now with the Affordable Care Act coming into place, they're more on the end of dictating what physicians, MDs, can do, more so, how do I want to describe it, like a treatment pathway.
Right.
They're
Right.
saying, all right,
Yes.
Dr. XYZ, I go in, my ankle hurts, doctor, take a few x-rays, yeah, I don't see any fractures, anything like that, throw on a pill.
Yes.
That's exactly what they're doing.
Yes.
So I believe, and again, being an ex-athlete and seeing you for a number of years, through multiple things, but going to the PT first is much more important than running to the MD and saying, hey, my knee hurts, my ankle hurts, my arm hurts. Because they're starting slowly to be programmed to allow the healthcare provider or payer to dictate what they do.
Absolutely.
And not too many MDs want to fight the payers.
Absolutely.
So from a PT standpoint, anytime an ache and pain, comes up, it's not, hey, run to the MD.
Right.
Fix me.
Yeah.
The pill's not going to fix you.
No. And I really appreciate that, and Dave has been a client for multiple years and he's in the medical field. And, when we look at that, just to take that a little further, it's not just the MDs, but in the larger systems, even the physical therapists, and everything's about pathways. Everything's about you have this many visits. And we're receiving info saying, okay, you have 6 visits, 8 or 10, which is fine. We'll start there. But like you're saying, maybe in the bigger issues, they don't want to fight it. We're on the phone saying, this person's not better yet. We need more, and we'll tell you why.
Well, it's
Yeah.
more, like I said, the payers dictating
Yeah.
how to treat the patient.
Yes.
As far as, try this, try A, if it doesn't work, go to B, if B doesn't work, go to C. So you're talking about costs.
Yeah.
Let's get right down to the nitty-gritty.
Yeah. Absolutely. All that money's coming back at you.
Yeah, exactly.
Yeah.
They've done that in the mental health field for so long that this is one of the reasons that we see a lot of this violence take place. People go into the healthcare system. Most payers give you 6 sessions with a mental health therapist per year.
Right.
So someone is put on a medication. You have a few psychotherapy sessions, and that's it.
Right.
And there's no follow-up, there's no continuity of care. If you see a psychiatrist who puts you on a pill, he may say, go find a mental health counselor. By the time you do that, have to locate another person. These people are already in distress. They're already compromised.
Absolutely.
It's very difficult for them to go seek out an additional caretaker than to have only 5 or 6 visits.
Yeah.
They're off the medication, there's nobody following up, there's no
Yeah.
continuity of care.
Yeah, and with that, and I've said this and I'll keep saying it, these both healthcare providers, the insurance companies and these larger systems, at some point there will be self-implosion. You cannot run a system like they are being run. There's no way. So hopefully, a bunch of us aren't compromised in the process of that. However, stay tuned, because shifting is occurring, and remember, you have choice. And you really have choice, and especially now, if you have health insurance, you're gonna have to shift, shop around, talk to people, do what you need to do. But please remember, you're an active participant in your health. You're an active participant. You don't have to watch those commercials and all those other things. Take the steps to learn and grow in your health. And thank you so much for coming.